For the next 29 consecutive days, we will follow the Tokyo Summer Olympics Games from a global health perspective. Today we discuss what it means to hold the greatest international sports event during a pandemic, the risks, the surprises that we will encounter, and the questions that you will have. Each workday, we will provide to you the most current situation in Japan and in the world. We hope that you will subscribe to this unique channel, trusting that you will find it useful. I am pleased to present to you our global health reports. We welcome you to our very first issue of Olympics Countdown, published daily. In this channel, Global Health Reports, we come to you as health scientists and public health experts who were engaged at a federal emergency agency throughout 2020 in the U.S. response to COVID-19. As researchers continuously involved in studying pandemic COVID-19 from its earliest stages in late 2019, we reviewed over 15,000 COVID-19 articles and news in multiple languages and published scientific papers on subject. We also both teach global health and are frequently invited to speak and work as subject matter experts. Our intention is to follow the progression of the pandemic throughout the Tokyo Olympics, chronologizing significant information and new updates while we apply our knowledge of the novel coronavirus and its rapid evolution towards becoming a more infectious and deadly disease. We will be providing information specifically for the Japanese, apart from the information that we are providing to the rest of the world. We will be discussing disease transmission pathways, prevention strategies, including social distancing and other engineering controls that we will have great impact on all people. It is our intention to share our information to help inform you. In this video, we will discuss the significance of the 2020 Tokyo Summer Olympics to global health security, both from the global situation perspective and from the Japanese situation perspective. We embrace that the health of one nation is really the health of all nations while in a pandemic. As we wrote in our forthcoming paper on Zika, international travel and trade, immigration, globalization and urbanization, including severe weather, emerging and re-emerging infectious disease, even the centralization of food processing, will increase threats to global health. Pushing towards the understanding of these conditions is part of the true spirit of global health and global health security. In this presentation, we will be discussing the history of the Olympics from an infectious disease perspective. I will be presenting a very brief background on pandemics and their relevance to the current global situation. In the next several reports, we will be emphasizing disease transmission pathways and infection control systems, and the Japan situation and newly emerging topics as they arise necessary to protect people within the context of the Tokyo Olympics. The 2021 Tokyo Summer Olympics will be the first time in the history of the world that the Games will be held while the world is engaged in combating a declared pandemic. We will discuss briefly what that means, while cautioning you that the COVID-19 novel coronavirus is not well understood. COVID-19 is changing. As it mutates and develops new variants, some now partially able to evade or escape vaccines recently developed to combat it, unanticipated threats now challenge the safety of the Tokyo Olympics. Public health is based on population health and epidemiologic science, which together could be described simply as seeking to understand disease transmission in communities while developing ways to design its mitigation and future prevention. Of course, although we are understandably aware and concerned about our own immediate communities, during a pandemic especially, we must become aware of the impact of regional, state, national, international, and global interconnectedness, because all of our health across all nations is in fact interconnected. CDC describes infectious disease outbreaks as involving more than two people, unrelated by genetics or blood, affected by a common source of infection. In practice, as outbreaks expand in size, they are generally referred to as epidemics, hence the use of the term epidemiology in their study and response. Pandemic comes from the Greek word pandemos, simply means all people. The nature of the term pandemic, from a human perspective, affects all people, and the use of the term global before the word pandemic is unnecessary and redundant. However, the World Health Organization will determine when a global epidemic should be determined a pandemic, sometimes based upon the extent and number of WHO regions impacted by a particular pathogen, a microorganism capable of causing disease. The field of epidemiology utilizes comparators to better understand, measure, and characterize communicable disease, or disease shared by people. The 2003 SARS global crisis is described in the literature as a global epidemic, though it was not proclaimed officially by WHO as a pandemic. However, the threat to global health by a predecessor of COVID-19, also connected to animal sources, either directly or indirectly, was dramatic. So much so that the WHO augmented the international health regulations with a revolutionary enforcement tool, the Public Health Emergency of International Concern, to combat future global epidemics and pandemics. Pandemic COVID-19 is the first officially proclaimed pandemic since 2009 pandemic influenza H1N1, which was also proclaimed a public health emergency of international concern, and the first application of that international health regulations enforcement tool. All modern pandemics have been influenza-related. HIV was considered by some to be a pandemic, though not proclaimed by WHO. COVID-19 was declared a public health emergency of international concern by the WHO on January 30, 2020, and a pandemic on March 11, 2020. Olympics history and the best comparator, 1918 pandemic influenza. Of course, journalists and diplomats do not follow rules of epidemiology when making comparisons to historical Olympics. Before COVID-19, the 1918-1919 so-called Spanish influenza caused 50 million deaths worldwide, according to CDC. It is generally referred to as a pandemic in the literature, although the WHO was not organized until 1945 through 1948. Nearly exhausted by early 1920, a new wave of infection was documented in 1920 according to some sources, but the pandemic was considered at its end before the beginning of the 1920 Summer Olympics. Certainly this would have been the best comparator when considering the future of the 2021 Tokyo Olympics. More recently, the 2016 Rio, Brazil Olympics caused the WHO to declare a public health emergency of international concern due to the threat of Zika, a mosquito-borne disease that for the first time in history evolved into a human sexual disease. Children born with undersized heads, called microcephaly, became a prevailing concern for some athletes considering boycotting the Olympics for fear of health effects to unborn children. Thomas Frieden, then CDC director, announced officially that the Olympic Games could proceed safely. The recent editorial in the Lancet Medical Journal stated that CDC has not made an official position on the Tokyo Olympics as of this time. The global situation. Africa. In his address on COVID-19 on June 14, 2021, WHO Director General highlighted that the global decline in cases of COVID-19 masks a worrying increase in cases and deaths in many countries, and that the steep increase in Africa is especially concerning because it is the region with the least access to vaccines, diagnostics, and therapeutic oxygen. Additionally, Kampala, Uganda, has entered lockdown amidst surging coronavirus cases and increasing detection of variants. Uganda Olympic Committee has registered 10 Olympics qualified athletes, and it is concerning that an Olympic team member arriving in Tokyo from Uganda tested positive for COVID-19. There is no word yet if the infection involved a particular variant. Also, Bangladesh has reported an increasing surge in new cases for the past 4 weeks. According to the World Health Organization, the emergence of more transmissible variants means public health and social measures may need to be more stringent and applied for longer periods of time, particularly in areas where vaccination rates remain low. In the United Kingdom, according to The Independent on June 21, 2021, Boris Johnson warned of a rough winter. The UK saw a 37% rise in the number of daily COVID-19 cases compared to last week, with 10,000 new infections reported on June 21, 2021. The lifting of COVID-19 restrictions is uncertain presently, and Cabinet Minister Kwarteng stated that lifting restrictions is unlikely before July 19, 2021. He stated that the government would always err on the side of caution. Additionally, the new report, released on June 18 by Public Health England, shows the Delta variant successfully breaking through or evading vaccines. Nearly half of deaths occurred in people already vaccinated with the second dose plus 14 days. The United States and the rest of the world, especially Japan, should be watching this carefully. Meanwhile, in the United States, state and local jurisdictions are determined to remain open as national vaccination rates have slowed, with less than 50% of the total population fully vaccinated, according to the CDC tracker. The Delta variant is predicted to soon become the dominant force behind future COVID-19 infections. An outbreak that occurred in a Florida administration building, reported by several local newspapers and ABC News, described 2 deaths and 3 hospitalizations last week. Employees were documented to be working not vaccinated, and mask requirements were relaxed. A spokesperson provided the assurance that COVID-19 safety measures, including mask requirement, will be in place again after the building is sanitized and cleaned. Our next report will focus on the Japan situation, and we will provide new updates. Thank you for watching our first public health report. Please subscribe to our channel and watch for our next public health report video, and contact us at the email address listed on your screen. We look forward to your questions and concerns, and we wish you the best of health. The Global Health Report is a All One Health Systems and Institute of Wellness production.